Good morning to all. Good morning. Today we are going to see a bone that is playing major role in midwifery practice, that is skull. So skull bone, why we have to know means, so the skull is the largest part of the fetus. So when compared with the other body part, it is the largest one, and also it may give some adaptation with the maternal pelvis while it is passing through the birth canal. So without any complication, it has to come out means we must know what may be the adaptation that takes place between the fetal skull and the maternal pelvis, and also the anatomical structures of the fetal skulls and the various diameters. Then only we can know what is the normal, which one is called as a deviation or defect. By knowing this, we can early detect the complication and prevent the further problem. And also the skull, it has the delicate brain in it. Everyone know very well it has the delicate. It causes for severe injury while it passing through the birth canal. At the same time, next we will see about the general introduction about the skull. So skull it has the three parts: vault, base and a face. So the vault is, the above part is called as a vault. Next this part is called as a base. Next this one is called as a face. So it has the three parts. Now let final year students will explain the detail about the anatomy of fetal skull. First I will give it to Ida. She will explain about the skull.
So good morning all. I am going to talk about the topic about bones of vault. So this is the bones of vault. There are four types of bones. First one is occipital bone, second one is parietal bone, third one is frontal bone, and the fourth one is temporal bone. So going through the occipital bones, the first bone. This is the occipital bone. This lies under the back of the head, and this is the foramen magnum. This foramen magnum helps or protects the spine, and this is the ossification area of the occipital bone known as occipital protuberance. And going through the second bone, it is the parietal bone. There are two parietal bones. First one is this and second one is this. This is the ossification center of the parietal bone known as parietal eminence. And the third one is frontal bone. As we said, parietal bone have two bones, like that the frontal bone is also having two bones. First one is this and on going to the frontal bone, as we said, parietal bone is having two bones. Same like that, the frontal bone is also having two bones. These forms a forehead or sinciput. This is the forehead part or sinciput. At the 8 years of age, these two bones club together and forms a single bone. And this is the occipital center of the frontal bone known as frontal protuberance. Frontal eminence.
Eminence or protuberance.
And the last but not least, it is the temporal bone. Temporal bones lies on the two sides of the skull, and it is a part of the vault. Thank you.
Good morning, students. I am now Kavya going to explain the
Sutures and fontanelles of the fetal skull. This is the frontal suture. It lies between the two frontal bones. And this is the coronal sutures. It lies between the frontal bones and parietal bones. This is the sagittal suture. It lies between the two parietal bones. And this is the lambdoidal sutures. It separates the parietal bones and occipital bones. Sutures are the cranial joints that separate the two bones. Then going to fontanelles. This is the anterior fontanelles. And this is the anterior fontanelle. It's in diamond shape. It's also known as brecma. It's a junction between a frontal suture, coronal suture and sagittal suture. It is
enclosed at 16 months of 18 months of age.
Then it is the posterior fontanelle. It is also known as lambda. It's a junction between sagittal sutures and lambdoidal sutures. It's also known as lambda.
It's normally closed by 6 weeks and it is in triangle shape.
Thank you.
Thank you.
Okay, now Vaishnavi going to explain about the diameters of the fetal skull.
So let's see the fetal skull of the diameter. So first of all, it's divided into transverse diameter and longitudinal diameter. Then transverse diameter is divided into two types, that biparietal diameter and then frontal diameter.
Biparietal and bitemporal diameters. Okay.
Biparietal diameter is 9.5 centimeter and then bitemporal diameter is 8.2 centimeter.
Biparietal diameters in the sense between the two parietal eminences. So it is 9 pi. Bitemporal means where the coronal sutures joins with the nape of the neck here. That is 8.2 centimeter.
Then we have to see the longitudinal diameters of the fetal skull. So it's divided into 6 types. The first of all, sub-occipito-pragmatic. Its diameter is
from the sub-occipital region to the
pragma. It's 9.5 centimeter, and then it's measured from the occipital prominence to the end with the pragma. Then we have to see the sub-occipito-fontanelle. It's 10 centimeter. It starts from the
sub-occipital region
to the fontanelle suture.
It starts from the sub-occipital region to the center of the frontal suture. Okay?
And then we have to see the occipital fontanelle is measured from the occipital prominence to the glabella.
So it starts from the occipital protuberance to the glabella. So it is center of the orbital ridges.
Its diameter is 11.5 centimeter. And then mentovertical diameter is 13.5 centimeter. It starts from the chin joints of the neck to the
highest point of the
vertex. And then vertical is 11.5 centimeter. It starts from the chin joints of the neck to the highest point of the vertex. And then last is pragmatic. It starts from, its diameter is 9.5 centimeters. Start from the chins of the neck joint to the pragma.
It is 9.5 centimeter. So these are all the different diameters. So now let us ask the question. What are the bones are there in skull?
Frontal bone, parietal bone, temporal bone, occipital bone.
Very good. So what are the sutures are there in bone?
Tricep suture, coronal suture, sagittal suture and lateral suture.
So what are the fontanelles are there in?
Anterior fontanelle and posterior fontanelle.
Yes, very good. I think everyone understood about the fetal skull. Thank you all.
Thank you.